Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Craig Halford, who is the president of First Contact Addiction Ministries. Welcome to our program today, Craig.
Thank you, Angela. It's great to be with you.
We are thrilled to have you with us. Craig comes to us. He received his Bachelor of Arts degree in Religious Education from Gardner-Webb University, his Master's of Arts degree in Religious Education from Southwestern Baptist Theological Seminary. He has been certified by SBIRT, a clinical skills training, and is an NAADAC certified recovery coach. He has served as pastor, minister of evangelism, education, and youth in over 20 years of ministry. He is a board member of the Blue Ridge Prison and Jail Ministry, and he has experienced firsthand the struggle and devastation of addiction. He has a passion for those suffering from substance abuse disorder, as well as family members who have had their lives dramatically affected by its consequences. Craig founded First Contact to help those struggling with addictions to formulate a plan to recovery and a plan to return to a life of normalcy. He serves to inform and educate families and provide comfort and support. We are so excited to talk with you and learn more about what you and your organization are doing. So why don't you start there and tell us about what is First Contact Addiction Ministries?
Well, Angela, we began First Contact Ministries about 8 years ago, and it was the ministry began basically out of necessity. I experienced with my son struggling with addiction and realized quickly once it came to light that the system is so overwhelmed by this issue that it made it almost impossible for me to figure out how to get him the help that he needed. And at the time, there were 3 other families that were friends of mine who were going through the same thing. Mm. We decided that we needed to do something to help families to figure out, once you find out your loved one is struggling with addiction and literally, you're talking life and death. It is an extremely serious matter that families are just exasperated, horrified, extremely fearful of what will happen to their loved one. And so we began this group. We just began First Contact Ministries by starting a family support group. Mm-hmm. And our objective was to help families to understand addiction, understand, why they no longer knew the loved one who was struggling and why they were doing what they were doing. So our objective was to help them understand what addiction is and what it's doing to their loved one, to help them, obviously, by showing them they're not alone. Many families struggle with the thoughts that they're going through this alone when there's literally, millions across this country that's struggling with the same issue. So we supported them to, our attempt was to give them support, help them cope, just trying to help them to cope with the process, because it's a lengthy process Our average numbers is when someone comes to us, they've been addicted for 15 years.
Wow.
So it's not something that is quickly fixed. So helping them to cope through that, and then helping them to develop a plan to deal with it. So we began doing that, but we quickly found you can't minister, you can't help a family if you're not helping their loved one. So we began digging and searching for treatment facilities. And over the 8-year period, we've become navigators. We have a database of rehab treatment facilities across the country that we refer individuals to depending upon their individual need. And so we basically, the way I look at it is First Contact Ministries is a twofold ministry. We help those who are struggling with addiction to find the help that they need, the treatment that they need. Plus, a huge part of that is once they get treatment, they come out and the saying is that the most dangerous thing someone who struggles with addiction can do is leave treatment, leave rehab. And that's because they go back out into the world. They go back out into a society that's not equipped to help them to learn how to live free from the dependence upon drugs. They go back to their usual relationships or their former relationships, which is the worst thing you can do. And so not only does our ministry help individuals to find treatment, but we're engaged through their treatment. And when they get out, we're there to help them to find, living facilities, to get a job, to get their license back. Most of them lose their license. To get medical help. They all have medical needs. To deal with their legal issues. They're all, involved in the legal system. So there's this incredible web that they have created for themselves. And when they get out, if there's no one there to help them, they'll get buried with the web that they've created for themselves, and they end up relapsing. That's one of the reasons why relapse rates are so high. So that's one side of the ministry. The other side of the ministry is trying to help families to deal. Because a statistic that very few times gets mentioned is for every individual who is struggling with addiction, there are minimum 5 family members who are devastated by it. It not only changes the individual's lives, it changes the family. It has a severe effect on siblings. It causes divorce. The damage is just, the collateral damage is staggering. And so, we do everything we can do to try to help families to deal with their loved one's addiction. So that's kind of a thumbnail, I guess you would say, as to who First Contact is.
Well, Craig, I just salute you for recognizing and having a very personal situation, a very personal need recognizing other families around you, and for building those bridges to find solutions and support on both of those spectrums for the individual and for their families. I
Thank you.
applaud that you have leaned into that and what had to have been an incredibly challenging time for yourself, and look at the impact that you're making through it all. And
It,
speaking of impact, how will the grant that you receive from Pisgah Health Foundation help you as you serve those who are struggling with addiction?
well, in order to help you understand how much you guys, and I can't tell you how grateful we are for Pisgah Health. There's a very strong possibility we would have ceased to exist had we not had your help. So first of all, you understand we do not charge anything for what we do. I was convicted by the Lord when I started the ministry that if someone came to us for help, we were going to help them. And a reality is that the overwhelming majority of people who come to us for help have exhausted all of their resources, much of their family's resources, and are in trouble for taking other people's resources. Mm-hmm. So, as the saying goes, generally when someone comes to us, they don't have two nickels to rub together. And so I'm just against all advice. I have said that this ministry, as long as we exist, will not charge fees. Rarely do we ever encounter someone who has insurance. So we're not going to charge. And so therefore, we are 100% dependent upon our community for support. Mm-hmm. And unfortunately, Henderson County in Western North Carolina has a really high percentage of nonprofits. I'm sure you guys are as much aware of that as anyone is. And so, the charitable dollars are, spread fairly thin. And so one of the things we did, and this will be taking you back into pre-COVID, we were doing basically two things. We were having events where we would raise money, and mainly what we call our annual gala, where we we were able to raise the majority of the funds required for us to function. And then we had a resale store, which, we sold items that were donated to the ministry, and we used that to help us to fund the ministry. We barely got our gala in. In fact, the week after our gala, the COVID shutdown occurred. We were, unlike most other nonprofits, we were fortunate enough to get our gala in, but our take this year was half of what we raised the year before. So that was a major hit. And then as we got into COVID, we ended up having to use ministry money to keep the store afloat, and we couldn't do that long. We ultimately had to make the decision to close the store.
Mhm.
So thankfully, we were able to file for the PPP loan and receive that, and which was got us through the most difficult month. But then we were faced with having to restructure how we raise money, and because the events just are not enough. The need has risen to the place to where events are not enough to fund us. So we were really in a very difficult place, and we had actually filed for a grant to help us to get a box truck for our resale store and some donation bins, which we were approved of, but with having to shut down our store, we didn't have the need, so we requested a variance or an adjustment of that grant just to use it to pay our monthly expenses for the ministry. So the last 3 months, we have used the grant funds that was approved, and we have used the grant funds to pay, our staff. We have 10 full-time employees and 3 part-time employees, and we've used those funds to pay staff expense and operational costs. So literally, were it not for Pisgah Health Foundation, there's a strong chance, at the very minimum, we would have had to have cut to a absolute skeleton staff, and it would have set us back an enormous amount, particularly given the fact that everything's going up except donations. So
Right.
your value to First Contact Addiction Ministries is critical, has been critical.
Well, thank you for sharing that, Craig. I'm so grateful that you were able to reposition and be able
Yes.
to continue moving forward. As we know, even through all of this in COVID, there's such a rising need for help for those who are struggling with addiction. And COVID has
Yes.
only, I think, kind of pushed for even more of that need along the way. Craig, what else would you like our viewers to know, or how can they come alongside and support or get involved or even find out more information about you?
Well, the first thing I would say is go to our website. It's firstcontactwnc.org. And check us out. We have videos there of testimonies of people that we have helped, lives that have been changed, and we're working on increasing the robust activity for the website, so that people can truly see the difference that our ministry makes in the lives of individuals and their families. So you can go there. We welcome anyone to come to our home office, which is 106 Chadwick Avenue, and we would be happy to give you the tour.
That's in Hendersonville?
Yes, ma'am. That's in Hendersonville. Great question. Because one thing, if I could pause for a minute, we've literally helped people all across this country. We've had people we've had calls from California. We have, looking for faith-based help, and we literally at this very moment have a young man from Washington State that we placed in a rehab in Florida, and he is now staying in our transitional house in Hendersonville. Mm-hmm. So the man has traveled the country. So we help, anyone all over Western North Carolina. We've helped people from the eastern part of North Carolina. We actually have an office that we opened in Spartanburg, South Carolina, just before COVID hit. Mm-hmm. So, we're struggling to keep that office going until we can get, our feet back on the ground down there, to raise funds for that. So, and then to pick up how you can help us, we, of course, we're trying to move from the event driven model of fundraising to monthly consistent donor model, to where we can take small amounts, just larger numbers of smaller amounts, and not be totally dependent on the large donations from individuals, businesses, and churches. So, donations, financial donations are always, that's the first and most critical way that we can be helped. We're always needing volunteers. We need folks to help us transport individuals. COVID has made it really difficult for public transport. COVID has made it very difficult for the first step in recovery, which is detox. It is a much more complicated process now than it was before, because we have to get them COVID tested. The cost for just the medical requirements of getting someone placed has gone up. So we're having to take individuals to get to the clinics to get them tested. We're having to try to find creative ways to house them while they wait to get into a rehab or to get into detox. So financial donations, we need, volunteers to help us with the events. We are continuing to try to do events. We're just trying to move away from the model of, solely depending on those to a much more consistent revenue stream, if you will.
Really looking for those people who recognize this and are willing to come alongside you guys, recognizing the need is ever increasing. But your expanse of your reach is quite impressive. And the fact that you are reaching, this young man, for example, all the way from the West Coast down to sunny Florida and back up here to the transitional home. And
it's incredible.
I'm sure there's so many stories like that, Craig, that you have. And let me just say, on behalf of the board of directors at Pisgah Health Foundation, thank you to you and the entire team for the impact that you're making, of course, across Western North Carolina and clearly beyond. The work that you are doing is certainly needed, extremely valuable, and we notice. And we just want to say thank you for all that you are doing.
Thank you, Angela, and God bless you and your board and the Pisgah Health Foundation. You have been a lifeline. You literally have been a lifeline for us through this extremely complicated and difficult time with COVID. And I can't say how grateful we truly are to you guys. And you're You are an invaluable partner to us, and we're just so grateful. We're just so thankful for you.
Thank you. It's truly a privilege to come alongside you, and I thank you again, and thank you for being here today. We also want to thank Wildflower Media for their creative and technical support in bringing Pisgah Health Today out to our viewers. We also want to say thank you to the Board of Directors and the staff at Pisgah Health Foundation, as well as to the Physicians Roundtable. So many amazing people doing great things to help impact the lives of Western North Carolina residents. Until we see you on the next Pisgah Health Today, stay well and be well.